Hello and welcome back to Hank USA. I'm Hank. We need to talk about something that starts next month, because a string of events is about to hit the finances of every senior on Social Security and Medicare. These aren't vague possibilities or political fights. They're 5 concrete events that happen on the federal calendar every single year. And every year they still catch millions of seniors off guard, because the official notices tend to show up with little warning well after the best time to get ready has passed. Today I want to fix that for you. We'll go through what's coming, the real dates, the most current numbers and projections we have, and the things you can start doing next month so you're in control this fall instead of scrambling. Prepared, not surprised. One quick thing first, and it'll help you stay ahead all year. If this video is useful, give it a like, subscribe to Hank USA, and turn on the notification bell. These government deadlines run like clockwork, but they don't send you a friendly reminder to get ready. The folks subscribed here get that early heads up before the deadlines close in. Thanks for doing that. Now, the first change. The first one is the 2027 Cost of Living Adjustment, the COLA. This is the one everyone talks about. The annual raise on your Social Security benefits that's supposed to help your check keep pace with inflation. It's officially announced every October,
but the guessing and the early estimates start months ahead. And that's where the trouble starts. All year, you've probably seen headlines throwing out different numbers for the 2027 COLA. Independent analysts have landed anywhere from about 3.8% to nearly 5%. The numbers bounce around because each early estimate is based on inflation data from earlier months. Right now, the picture is a little clearer, but it's still a projection. After May's inflation report, the Senior Citizens League, a respected advocacy group, put its 2027 estimate at 3.8%. Independent analyst Mary Johnson went higher to 4.7% and noted it could climb further as more data comes in over the summer. So what would that mean for your check? Take the more conservative 3.8% figure. On the average retirement benefit of about $2,081 a month, a 3.8% raise works out to roughly $79 more a month, starting in January 2027. An extra $79 sounds decent, but here's the warning I need you to hear before you plan around it. The official COLA, the one that actually sets your benefit, isn't based on the data we have today. It's based on inflation from the third quarter of the year, July, August, and September. We're not even in that window yet. So the final number could move up or down over the summer, depending on what happens with gas, food, and housing. Hotter summer inflation, higher COLA. Cooler, lower. We saw how messy this can get last year, when a government shutdown delayed the inflation reports the Bureau of Labor Statistics needed, and pushed back the timing of the official announcement. The takeaway is simple but important for your peace of mind. Don't build any budget or big decision around these early COLA estimates. They're educated guesses, not promises. The only number that counts is the official one. Wait for the SSA's formal announcement in mid-October. Better yet, wait for the personalized COLA notice the SSA mails every beneficiary in December. That letter shows your exact new benefit for the year ahead. That piece of mail is your source of truth. The second change is the Medicare Part B premium increase. And it's the one that frustrates seniors the most, year after year. It's the reason so many people feel like their COLA raise just disappears. Whatever the final COLA turns out to be in October, a chunk of it is almost certainly going to be taken back before it reaches your bank account. The reason is your Medicare Part B premium. For most seniors, that monthly premium, which covers doctor visits and outpatient care, comes straight out of the Social Security check. You never see the money. It's gone before the deposit lands. And like the COLA, the premium gets adjusted almost every year, with the new amount usually announced around the same time, in October or November. Look at what just happened. In 2026,
The standard Part B premium jumped $17.90, up to $202.90 a month. That was a big bite out of the 2026 COLA. Now connect that to 2027. Say the COLA comes in at 3.8%, adding about $79 to the average check. Then say Part B goes up another $15 or $20 for 2027, which is realistic given how healthcare costs have been climbing. Suddenly your raise isn't $79 anymore. After a $20 premium hike, the new money actually showing up is closer to $59. A quarter of your raise, gone. It's not a trick, it's just how the math works. But it sure feels like one. This plays out the same way over and over. It's the single biggest reason seniors say, "I got a raise, but my check stayed the same." They're not wrong. The headline COLA promises more than the net deposit delivers. Knowing this now, months ahead, is its own kind of power. You won't be blindsided when your January deposit is smaller than the big COLA percentage led you to expect. You can budget for the real net increase instead of the gross one. The third change is the Medicare Annual Enrollment Period, and it's the most actionable item on this list. Open enrollment runs October 15th through December 7th every year. None of that is news to anyone on Medicare. You get the mailers every fall. The problem is that the cost of ignoring this window keeps growing, and a lot of seniors still treat it as optional. It's the opposite. It's your one chance to take control of your health coverage for the entire next year. During those 7 weeks, you can switch from one Medicare Advantage plan to another, change your standalone Part D drug plan, or move from Medicare Advantage back to original Medicare and the other way around. It's your yearly shot to make sure your coverage still fits your health and your budget. So what happens if you do nothing? If you skip the mailers and let December 7th pass, your current plan just renews automatically. Sounds easy, and that's the trap. Automatic renewal does not mean your plan stays the same. Every year, insurers can change things. The premium, the deductible, the copays. They can change the formulary, which is the list of drugs the plan covers. So a medication you've taken for years might suddenly cost more or not be covered at all. They can change their network too. The doctor you've seen for a decade might be out of network next year, turning a routine visit into a few $100s out of pocket. By law, the insurer has to send you a document called the Annual Notice of Change, or ANOC, each fall. It spells out every one of these changes, but honestly, it's a dense, multi-page thing that looks like junk mail, so most people toss it or file it away unread. That's the costly mistake. Those quiet changes, a drug moving to a higher tier, a specialist leaving the network, go unnoticed until you're standing at the pharmacy or the doctor's office in January with a surprise bill. By then, you're locked into that plan for 12 months. So here's your step, starting now. Make the commitment. When that annual notice of change shows up this fall, treat it like the important financial document it is. Open it right away. Find the summary of changes. Then do the part that matters most. Compare your plan's new costs and coverage against at least 2 other plans in your area. The best place to do that is the official site, Medicare.gov, and its Plan Finder tool. You enter your prescriptions and your doctors and see exactly how different plans would treat you. Do this one thing every year, whether or not you think you want to switch, and you'll be the one who catches it when your plan quietly gets worse before you're stuck with it. The fourth change is really a resource, and it's free. I know what some of you are thinking. Comparing Medicare plans sounds complicated and overwhelming, and you wouldn't know where to start. That's a fair reaction. These plans are complicated by design, but there's a powerful program almost nobody knows about, and it costs nothing. Every state has a federally funded program built for exactly this. It's called SHIP,
the State Health Insurance Assistance Program. SHIP gives you free, one-on-one, unbiased counseling. That last word is the whole point. If you call an insurance agent or broker, they can be helpful, but they usually earn a commission based on which plan you pick, so there's an incentive to nudge you towards certain plans. SHIP counselors have no financial stake in your decision. They don't sell anything. They're trained, certified staff and volunteers whose only job is to help you. They'll look at your specific medications, listen to your needs, and walk you through the differences between Original Medicare, Medicare Advantage, and Part D plans. They'll help you use the plan finder and translate the jargon, premiums, deductibles, formularies, networks into plain English. Finding your local SHIP is easy. Search SHIP Counseling plus your state, or call 1-800-MEDICARE and ask them to connect you to your state's program. But here's the key piece of advice. Reach out early. Once open enrollment starts on October 15th, SHIP counselors get buried in calls and their slots fill up fast. Trying to get help in late November is like trying to book a tax accountant on April 14th. The smart move is to call in September, even late August before the rush, so you can get a thorough, unhurried conversation. That one step can save you thousands of dollars and a lot of stress. The fifth change is the final official numbers and the IRMAA surprise. Your last piece of the 2027 puzzle won't be locked in until late in the year, usually November, when the Centers for Medicare and Medicaid Services announces the exact dollar amounts for next year's Medicare premiums and deductibles. That's the announcement that pins down your real net increase. It's the moment the two moving parts, the COLA and the Medicare premium, are both final, and you can finally see what your actual check will look like. But there's another detail in there that catches some retirees completely off guard: the IRMAA surcharge. IRMAA stands for Income-Related Monthly Adjustment Amount. In plain terms, if your income is above a certain level, you pay a higher premium for both Part B and your Part D drug plan. It surprises people because the income they use isn't your current income. They look at your modified adjusted gross income from your tax return 2 years back. So for your 2027 premiums, they're looking at your 2025 return. If 2025 was a high-income year because you were still working, sold a property, or had big investment gains, you could get hit with an IRMAA surcharge in 2027, even if your income is much lower now. And this isn't pocket change. The surcharges can add tens or even hundreds of dollars to your monthly Medicare cost. So how do you get your final official numbers? Watch your mailbox. Every Medicare recipient gets the Medicare and You handbook each fall, with your confirmed plan details and costs for the coming year. And the SSA mails you that personalized letter in December with your exact COLA and your new benefit after deductions. Those two documents are your real, personalized statements for the year. They have your specific numbers, not estimates, not national averages. They're the only numbers you should budget with. Let me bring it all together with what to do starting next month. First, the 2027 COLA is announced in October. Current projections run from about 3.8% to 4.7%, but the real number depends on summer inflation we don't have yet. Your move. Ignore the hype and wait for your official SSA notice in December. Second, whatever the COLA gives you, expect part of it to get eaten by the annual Part B premium increase. Your move. Plan around your likely net raise, not the headline number. Third, Medicare's annual enrollment period is October 15th through December 7th. Your move. Put those dates on your calendar right now and commit to reading your annual notice of change and comparing your plan on Medicare.gov this fall. Doing nothing is a choice, and usually an expensive one. Fourth, if comparing plans feels like too much, you have a free expert in your corner. Your move. Find your state's SHIP program and call them in September before the October rush. And fifth,
The final premium amounts, including any IRMAA surcharge based on your income from 2 years ago, get confirmed in the fall. Your move. Watch for the Medicare and You Handbook and your personal SSA COLA letter. Those are the definitive guides. None of these 5 things needs action from you today. But the window for easy preparation opens next month, and every one of them gets more stressful and harder to handle the longer you wait. Sorting this out in September is calm and strategic. Trying to figure it out in late October is a scramble. Thanks for taking the time to get ahead of this. This has been Hank with Hank USA. If it helped, please give it a like, subscribe, and share it with a friend or family member who's also on Social Security or Medicare. A little preparation goes a long way. I'll see you in the next one.